Good evening. I'm Dr. Sandip Jain. I'm a plastic and cosmetic surgeon from Mumbai, India, and I've been in this field for almost 25 years. And I've come across this BodyJet liposuction device almost 12 years ago, and I decided immediately to incorporate it into my practice. And I must say I have not regretted that decision, and I've been most impressed by the consistency and fail-proof service of this instrument, and it has given some very good results in all of my patients, and I'm very happy with the machine. So I'm here in Kathmandu, Nepal, for transferring my experience in the use of BodyJet liposuction device, because Healthy Choice Clinic has recently purchased this machine, and I am here to advise them and train the surgeons here how to use this machine and how to service it in a proper fashion. So BodyJet liposuction is actually a water-assisted liposuction device. It is the only device which uses the power of water jet for liposuction. There is no such device available anywhere else in the market. It has been originally designed and produced in Germany, and the quality is top-notch, and it rarely requires any servicing. And the basic principle of this machine is that a spray of water is used to dislodge the fat, and this makes the effort of the surgeon very minimal, and he can extract the fat very easily with this device. So BodyJet has a very basic principle of using a two-channel cannula, where one channel is used for emitting a spray or a mist of tumescent solution, which, as I have said, dislodges the fat, and the other channel is used for aspirating the fat from the area targeted. And this mist of local anesthetic solution also provides pain relief post-operatively to the patient. So one of the biggest advantage of BodyJet liposuction is that it is precise and almost pain-free for the patient. Therefore, the recovery is faster compared to conventional liposuction. Also, it is a very safe technique. There is no risk of skin burning or skin necrosis. So the recovery is very fast, including the swelling and bruising, which usually follows liposuction, is minimal with BodyJet liposuction, and therefore usually patient bounce back very quickly after BodyJet liposuction. Usually it takes about a week's time for patient to get back to full routine following minimal to moderate liposuction. If a very large liposuction is done, it may take approximately 2 weeks, but the recovery is nearly almost painless. See, liposuction started almost 40 years ago with the conventional suction-assisted liposuction, and as the number of liposuction increased and as the patient demanded more areas to be treated, in order to reduce the effort of the surgeon, so assisted devices have been designed, starting with power-assisted liposuction, ultrasonic-assisted liposuction, laser-assisted liposuction, and the latest technology is the water-assisted liposuction, which is the trade name for that is the BodyJet liposuction. Yes, so as I have mentioned, it's an assisted liposuction device. The main purpose of this machine is to reduce the effort of the surgeon and to reduce the pain, swelling, and bruising in the patient, so that the recovery is faster. And as the effort required by the surgeon is less, so the surgeon can concentrate on giving accurate contouring of the target area, and also he is able to perform a larger amount of liposuction, and more patients can be operated in a day by the surgeon because of the less effort required. Besides the very minimal risk associated with any surgical procedure, Thankfully, body jet liposuction doesn't have any risk associated with its use as compared to, say, a laser assisted liposuction or ultrasound assisted liposuction, which carry a very small risk of skin damage during the procedure. The main aim of liposuction is inch loss or body contouring. So this has to be emphasized to the patient that liposuction is not a weight loss procedure. Although with liposuction you will experience weight loss, but that is not the main purpose of the surgery. It is to reduce the inches in certain areas of the body which are not responding to diet and exercise. So the ideal candidate for any liposuction or for body jet liposuction in particular is a patient who has got no medical conditions and is of normal weight or near normal weight. Ideally, the body mass index or the BMI should not be more than 30 to 33, and patients should be encouraged to lose weight if their BMI is higher than 33 and then come for liposuction. And if patient has never exercised or diet in the past, then this should be counseled to the patient that they start doing it, because it is important that they continue with the same after the liposuction. One of the biggest or advantage of body jet liposuction is that you can do small liposuction under local anesthesia, and this is not possible with any other technique. So this is one of the plus points. If you want to do 1 or 2 target areas only, then you can perform the procedure under local anesthesia, which means the patient can be discharged very quickly from the hospital, probably on the same day. But if any large liposuction or multiple areas of liposuctions are required, then it is safer and more comfortable for the patient to be put to sleep or to be given general anesthesia. We can cover almost entirely one whole area. Say for instance, the whole lower body can be done at the same sitting, and if the patient is young, fit and healthy, you can treat almost all the areas of the body in one sitting, provided the BMI is less than 30 and patient has no medical condition which can put the patient at risk. There is very minimal scarring with liposuction, particularly body jet. Only the access points or points from where the injection or the cannula is inserted, they leave a very tiny mark. Otherwise, there is no scarring in the body anywhere else. So if the patient is under general anesthesia, obviously they are not going to feel any pain. Under local anesthesia, as this technique involves spraying of local anesthetic while doing the liposuction, patient generally do not feel anything during the liposuction if it is being performed under local anesthesia. And also after the surgery, there is minimal or no pain following body jet liposuction. So I generally combine other surgical procedures with liposuction, for instance tummy tuck or even breast enhancement or breast augmentation. It is very common to perform combined surgery, and again the criteria remains the same. A patient's BMI should be less than 30 or 33, and patient should be in a good medical condition and healthy. Then you can perform these combined surgeries very safely and without any serious side effects to the patient. So generally for the initial or the early post-surgery phase, we advise the patient to have a low salt diet, because salt is known to increase swelling. So we generally tell the patient not to have any processed food like which have a lot of salt in them, which can increase the swelling, and also encourage them to resume their normal routine and exercise as soon as possible, because this will help to reduce the swelling and to help further refine and improve the result. And it is emphasized to the patient that they have to wear the corset or the compression garment for 1 month, which helps in reducing the swelling and also helps in giving a better shape to the area treated. And also they have to have a change in in their lifestyle and follow a healthy lifestyle. For instance, diet and exercise should be part of their routine. So this will maintain the result, and result will be permanent and long-standing. Yeah, for small liposuction, patient can resume heavy exercises in 1 or 2 weeks, and for large liposuction, maximum 4 to 6 weeks, it will take them to resume their heavy exercise routine. Otherwise, walking is very safe exercise which can be resumed the next day or even the same day, and this is something which patients should be encouraged to do. If the patient selection is proper, then the skin appearance will remain smooth. However, if you select a patient who has a lot of loose skin or poor elasticity of the skin, then you may end up with surface irregularity. So, which is not the complication of liposuction, but it's the complication of wrong patient selection, and such patients should not be encouraged to have liposuction. See, we emphasize to the patient that the final result will take at least 3 months, because the swelling has to go down and then the skin has to shrink or contract to adapt to the new shape. So that is something which patients should be emphasized again and again, because some patients expect that the result will be immediately, but that is not the case, because the swelling hides the final result, and swelling takes 1 to 2 months for it to go away, then the skin shrinks. So final results is anywhere between 3 to 6 months, and during this period the patient has to follow a healthy lifestyle, watch what they are eating and continue with their exercise routine. So in such cases you will get a fantastic result, and patients generally are happy if they are counseled about these points. Generally we see the patient 1 week after the procedure, when, if any stitches have been taken, are removed, and then after 1 month and then 3 months. And if the patient at all these visits is encouraged about the healthy lifestyle and what diet they should have, and generally after 3 months no follow-up is required. So as I had mentioned earlier, liposuction is not a shortcut to lose weight or to reduce the inches. I always encourage the patients to reduce weight normally, and only in cases where there is stubborn weight gain or stubborn areas which do not lose inches despite doing all the exercise and diet, then in those cases patients are encouraged to have this procedure and they will get a good result. But if patient has never exercised or dieted in their life, and if they opt for liposuction, then they will be disappointed, because if they gain weight substantially after the procedure, the areas which have been treated by liposuction, the fat deposits will come again and patient will experience disappointment. So very important that patient has tried all natural way to lose fat from certain areas, and if despite all the efforts this has not happened, then they are an ideal candidate for liposuction, particularly body jet liposuction. I would like to congratulate Dr. Udit, what's his last name? I don't know. I would like to congratulate Dr. Udipshrestha for procuring this machine, because I think he's made the right choice. Body jet liposuction machine is the best liposuction machine, I would say, and it would give good results to the patient, and I'm very happy to be part of this effort, and I'll be happy to come and visit the clinic again, and I wish Dr. Udip all the very best in his new endeavor. Thank you.